Hi guys, I'm Crystal and I'm gonna be the chair today. We're gonna be covering chapter 32 and 33, basically just anything like any of us are having like any trouble understanding or wanna like go more in depth with. Does anybody want to share anything from chapter 32 or 33? I mean 32 and 33.
For the speed class, I feel like that kind of confused me, and I know it kept on being brought up throughout the other chapters too. So I kind of wanted to maybe just go over that and to if someone has like a way of like clarifying exactly like what it is. What is it?
I think it's on week 8, right?
Yeah, it's one of the first chapters. Where is it?
The way I understood that, I don't know if it's correct though, is that it's like a preset that whoever is in charge of installing the tube can place, and then that's going to dictate the sensibility of the plates to radiation. So it has 100, 200, 300, and 400. Those are the levels. And the greater the number, the longer it takes to complete the exposure, but also the less dose because the more sensible it is, I think.
Yeah, I think that's what was confusing me with was when I was talking about like it's inverse to the amount of exposure required.
Mhm. Um, does your place have the S number? The one
Yeah.
that the greater the exposure, the lower the dose?
Mm-hmm.
You can think of it like that.
Okay.
And then
Yeah.
the speed class is what I understand, not something that we mess around with. It's just what came with the software or the okay.
Correct.
Yeah.
Yeah.
Yeah,
And
that's something that nobody can change. Maybe just the manager or the director of the department, and they will have to get one of the engineers or the yeah, whoever fixes the tube when it gets broken, and those are the ones that can change it.
yeah, I saw it be brought up again when they were talking about how to reduce patient exposure.
Mhm.
What was the speed class? Like it should be like instead of 200, it could be a bigger like 300 and it
Mhm.
would reduce the amount. And then I'm like, why are they going with 200 then for like these days? I think
I
these
think it's just like the standard, right?
Yeah, he said that
200.
that is the speed that they used to utilize with film, and that they never really changed it when they upgraded to digital, something
yeah.
like that.
You know what messes me up is that I don't think at any does your site actually still use CR? Because we still talk about CR like we use it, and I'm not sure if any of us
Yes,
do.
my
My
site
site
does
does.
still have
Really?
CR.
Yeah, mine too.
Oh wow.
Yeah, I mean, our main place that in the main hospital at Cottage, we don't have it. Well, we kind of do, but also go to Cottage Rehab, which is just across the street, and like we'll
Mhm.
go there too to take some images, and all of that equipment is CR. So
Oh,
like you really have to remember to like scan it and put it in the thing,
The
and
board.
then like erase any like back like if we don't know if the plate had been used already, we had to like put it through an erasure cycle.
I
Like,
didn't know we
so
still
pretty
had
much I'm able to like apply everything we've learned.
Same
That
here,
that's
exactly the
really
same.
cool
That's
because
really cool.
the tech at our spot, because Santa Paula is is a sister hospital to VCMC. So one of the techs was like, "You guys should really go to Santa Paula because they have a lot of old, they have CR, they have a bunch of like dinosaur stuff." And they're like, "What if like you graduate and then you go to a place that has CR and you're lost and you don't know how to use it?" And so I'm like, "Yeah, that's true. They call us all spoiled."
It's gonna be me because I
Yeah.
haven't touched a CR plate at all.
We have them in our department, but just kind of laying around. But it's like it doesn't even work. So
We have one in our department too, and I thought it was just like there for looks and just like they don't use it because all the rooms have like the newer DR equipment. And then our Devo disc went out. And so then they have been using it. I've seen them actually use it, and I was like, wow, that thing actually turns on. But they started using it when they need that room to take like an AP chest on a wheelchair.
Yeah, same. It's only like when we need it. Because usually we just do the DR, but if like something's going on with the DR, and we'll just switch it to CR. Because our room has one of the rooms has the ability to go from DR to CR. So we'll just switch back and forth. But then there's a room specifically for CR.
wow.
The one's like never really used unless it's like super busy and like they have to use it, just to get patients out. But yeah, other than that, it's like not touched.
Dang.
I think it's good to know, I guess, because you never know when you're gonna use it.
So it's still applicable, is what you're telling me.
Still
Okay.
out there. You might see it.
Mhm.
Okay.
That's gonna be me because I'm going to Marion then.
And they have, oh, do they have it?
Well, Sam just said.
Oh, and
Yeah,
then
So I
I
was
do.
just like, oh man, that's gonna be me now. I'm gonna have to
Yeah.
learn.
It's like Luis's, because there's a floral room, and whenever the tube on the X-ray room goes down, they use the floral room to do X-rays, but they'll use CR. Or like Angela's, there's a building for bariatric patients, and no, sorry, geriatric patients, and then you have to go across the street for it, and you take CR with you.
Wow.
Yeah.
Does anybody else want to discuss any other subject?
Mm, I kind of do. I was hoping someone would go over the deviation index because I've seen it on my on once I take an X-ray, I see the D number and how it's either negative or positive, and we're essentially the tech told me that we had to get close to 0 at all times to get like the ideal exposure level, but like what does it mean?
to me, it
Yeah.
kind of seemed like kind of the S number, but a range of like what's good between. Is that what it is? Because that's what
I
it's.
think so, because I think on the care stream, because we have one, it's like 1,200 to 1,500. It doesn't even like have like a range for each thing. It's just that range.
Yeah, because we have a chart of like extremities, abdomen, and it says like an S number range that it should be. And so
Mhm.
that's what it sounds like this is, because it says like proportional, directly proportional or inversely. And like some of our things are inverse. It says like a range.
Mhm.
Yeah, I had the exact same question, like the difference between EI or exposure index and DI, the deviation index.
Yeah. Human value. Is
What
it
I
like in milligray?
uh
No.
I think is is it SV? I think it's SV. And
Mm.
Siever. Yeah,
Siever?
Siever.
Oh, and
Yeah.
sieverts.
I think, I'm not sure. But I think the exposure index is like what you were saying about the portable, the Carestream.
Yeah.
And that's equivalent to the S number in the X-ray rooms that just measures the amount of radiation recorded by the image plate. And then the deviation index, I think it's the margin that you have to dictate if you under or overexposed. Like at my site, it's for the portable 1,300 and 1,700. That's like the threshold. If you go below that, you underexposed. Above that, you overexposed. I think that's
Oh.
what it is.
It still sounds the same to me.
I think
So
it's like a range then, because I
Yeah.
think
yeah,
we have two. We had the Fuji, and then that one it doesn't like every body part has something, but like on the care stream it's just one range. Like it's not like different numbers.
exactly though. So the EI tells you the exposure and the deviation index tells you the range.
Yeah.
Okay.
I think. I'm not sure. If someone,
On page 550, it says the deviation index is intended to indicate the acceptability of SNR, which is the signal to noise ratio conditions from selected values of interest. So, and then at the end it says, EI and DR are guides to exposure and should not be misconstructed to, oh wait, never mind. It's basically saying like it's part of a value. It's not like the value. You know, like a S number is like your guide, and I think the DI is like a contributor to that number. You know what I mean?
Oh. Hmm. Okay, that makes sense then. Does anybody else have anything else they want to go over? Luis?
Probably like I think the pre-fogging of the CR cassette, I was like, what does that mean exactly? And that one's from chapter 33.
Pre-fogging to me is like, I think it's like a CR thing, right? Like if things don't get like erased properly, or
Yeah, it's
like
for CR, but
it's like a light that is still on the plate.
okay, so like even
But
like it just didn't get erased.
I think so. Let me see.
yeah, for that one, I think it's when they have the CR plates too close to a tube and they catch some of the radiation. And I don't know if you guys remember when I don't know which professor was explaining the difference between CR and DR. They said that DR will not absorb radiation unless you tell it to, but CR it's always absorbing.
Mm-hmm.
Oh.
Yeah.
So whenever it catches radiation, and like for example, if it's too close to the door of the X-ray room, it'll catch some of it. And if it doesn't get erased in a while, it accumulated, and that changes the yeah, it creates like a fog effect when you expose. I think that's what it is.
Okay.
Yeah, I remember him saying on the video like there's like outside radiation from the building. Like it could be from the building, it could be from kind of like anywhere. And I was like, what
Mhm.
the hell from the building?
Like
Oh.
it's
From the
super
building.
sensitive to any type of radiation. Because I know we're like exposed to radiation just like on a daily basis. Like that's just what it is. So even like that type of radiation is absorbed on the CR plate.
Think so. Right?
This has got me wondering
Sounds
if we
legit.
actually like give off radiation ourselves too.
Yeah.
Well, they well, not that I barely learned, but like they I think it's like in nuke med, they inject like radioactive contrast into you. So like we haven't been able to go to certain like rooms or anything because the patient is like radioactive or whatever. So you're like exposing yourself to radiation, like from that individual, that person. I was tripping out when I found that out. I was like, what
Oh
the?
yeah, I just heard about that too.
That's interesting.
Sarah was
Yeah.
telling me that they used to like have a hotel specifically for the patient to go to.
Yeah, they have to like
stay.
stay away for a certain amount of time.
Yeah, and it's like a few hours and then they come back, but then they stopped doing the hotels because I guess like they felt bad for like the employees and stuff like that of the hotel cleaning that up, you know?
They should have a badge too to see how much radiation.
Yeah,
Like,
because it's like a lot of radiation. So it was like that was interesting. I was like, oh, what the heck? I never heard of that.
Me too. I was like, they're like
Yeah.
superheroes over there.
It's trippy.
I was gonna ask, I was interested when he was saying that alternative processing algorithms, like when he was talking about text using like a foot algorithm on a chest because it like looks better. And
Mm.
like I have never seen that. And I was wondering if any of you have, because that is just like, I mean, in the images he showed, the foot algorithm did kind of look good.
Oh.
But obviously not to do that because that's tampering with data. But I've never seen anyone do that.
They
Like,
do
I've
that
never
on
seen.
my site.
they do?
I've seen it where like they'll take a picture and then they'll change it out for like a foot because it looks better.
For a chest?
Yeah, like I don't
Not a
know, they'll
thing?
change it like that. Especially on the portable, I think it's more
You
common.
can change it after you take it. You don't have to like
Yeah, they'll
put
take
the
it.
exam.
Like we had a patella and like you couldn't really see it. So they changed the algorithm to something else. And they were just trying like a bunch of things like humerus, chest,
What? That's
pacing,
insane to me.
seeing if it would look better because you couldn't really see the separation of the joint.
Yeah, I've seen it too. Same thing. It's usually on the portable.
It's like
Like,
after they take it.
yeah,
Yeah.
they'll like shoot it. It'll look super white or whatever, or like super dark, and they'll just switch it to something else. Like they'll just go through all of them, see which one looks better.
And then it'll change like the S number on there too. So
Yeah,
like
like
it's
totally
They
manipulating the data.
like if
do they
it's
annotate
1,000, it'll go
anything
like
on it?
500 or something.
Mm-hmm.
It's super
What?
dramatic.
Do they annotate anything on there? Like how he was saying, like if you kind of go deep dive into the exam and you see foot, like liability or whatever. So do they do like the text annotate anything on it for that when they change the algorithm or no?
Not that I've seen, no.
No. Well, they said that if they send it to, I think it was like Steele was saying how when they send it to like PACS and stuff, like they delete it or edit there. It doesn't show like the percentage or something like that of like how many repeats and stuff like that.
Oh, yeah, that was
Because like the
interesting
same
too.
thing
How he was talking about how you can
I,
delete.
I see
Pack.
people do that and I was just like, oh, like they do it.
Wow. Yeah, that was interesting. I'm like, I haven't seen anyone use a foot or anything for
Yeah.
like different. But I guess it does happen, and it sounds like.
I think a lot of like older techs too like to do that, or like they like to crop their images a lot.
Mm,
Yeah. Well, like from what I've seen, like older techs will do that, like crop it.
I kind of got scared after Professor K was like telling us like don't do that because they make it seem like oh it's okay to like crop and then after you hear like no like don't do that it could like if a quality control or someone like catches that.
They
So
could
now
go back and
like
look at it. Like I'm like, oh no, that what if that happens to me?
yeah so I've been like I'm just gonna keep it. I'm not gonna crop it like if they tell me you can crop it down more. Oh I can't.
Yeah, that's what I've been saying. That's what I've been telling. Because I'll be like, oh, I don't edit it. Like I'm not allowed to crop it. So they'll be like, oh, okay, because like I have an older tech that always wants to crop everything, and I'm just like, oh no, I can't. Like it has my name on it. Don't do it.
I think you can like crop just like the very edges. Like you know how sometimes it shows up white edges?
Oh
Like
yeah.
crop the little white edges out. That's
Yeah,
fine.
that makes sense.
Yeah. That's like that's as much cropping as I do, at least.
Hmm.
I don't crop anatomy.
Yeah, me either. Does anybody else want to go over anything?
It's not really a question, but just kind of like what you guys think of. I've asked techs like how do they know when to use a grid? Like on portables or like cross tables or just like in general, because even in the room they'll pull out the grid. And I don't get like straight answers. I've gotten like some people use it for, cross table hip, some people don't. It's just like tech preference. So I know Steele's going over like it's mostly for bariatric patients when you have a lot of matter. Um, but I feel like there's other ones like a cross table hip and stuff. So I don't know, how do you guys kind of like decide when to use it and when not to use it?
I heard like a knee or bigger, like a knee or a shoulder. Um, I don't know.
Like a virtual grid? Does
Well,
right?
like, like on a portable and stuff, like, you text take a grid if they're doing
Oh
like
yeah.
an exam or something.
So on mine it has like a virtual grid and like we could use the real grid, like the thing you just put on.
Mhm.
So they'll use it mostly like on chest or like KUBs. Not really extremities at all.
Okay, so mostly just like body part, and if they're
Like they'll take it off like the grid for like body parts usually like
I think it's
extremities.
like based on thickness.
Yeah.
and kind of
Um,
what you're shooting through.
I think whenever you're going to use big technique, that's when you use it. Like if you're doing an average, you don't have to. But like you said, bariatric patients or for a cross table, you need a ton of mass. Because I don't know how it is in different sites, but in the room that we do it, the tube cannot get close to 40 inches, so we do it at 72. So we go usually 90 kV and 100 mass, so it's a lot.
Wow, that is a
Wow.
lot.
Mhm. And if you don't do it, it doesn't look good, so you need that much. And I think that's when you use a grid. You're using a lot of technique.
Okay.
So just to confirm, like grid is just to get minimize the scatter radiation, right?
Mhm.
Right. So we usually use to get rid of scatter. The cases that we see more scatter is high KVP and then mass thickness of a patient where we get more scatter, right?
Yeah, yeah. So for example, on an average person on a knee, you will do, I don't know, like 75 or 80 and 6 or 8, right? But for a bariatric patient, you may do 90 and 14. So you're pretty much doubling the mass. So, but yeah, I think you're right about the KV. If you go up on KV, you'll get more scatter. And I think that's why they use the grid. But then I'm confused because on this past lecture, I think the um last section he was talking about the myths, and one of those was that high KV creates scatter. Then it's better to use high KV and lower the mass.
Mhm.
He was saying
Mhm.
that the algorithm on DR pretty much cleans up scatter, so it doesn't matter anymore.
I know, because I always put like high KV and contrast because of the scatter as a thing. Because from a Chuck's class, I feel like he would always like put like KV equals like lower contrast because of scatter. And then in the past lecture, he said something about like it doesn't really affect it too much as far as contrast because of the algorithms.
Hmm.
Yeah.
Yeah, and personally, I have had to do many chest routines on babies. I don't know what's going on around here, but the way we set it up, we put the baby at the end of the radiographic table, and I use the portable for that at the other end. And if I do the technique that is suggesting, which is like 65 and 1.8, I get a lot of noise model, and I've had to increase the KV to compensate. I guess I don't know if it's the penetration or the distance, and I go up quite a lot. I got to like 75 or 80, and that's when it looks decent. It looks good. Otherwise, it's underexposed.
Wow.
And you
Yeah.
keep the same mass.
Yeah.
Okay.
So yeah, same mass, and it looks much better. So I think what he said on the past section is like good for patient dose. Just go up in the KV and don't really touch the mass unless you feel like you have to. It's better than like taking 2 images, but yeah, it works.
Yeah, I guess I also get confused like in the clinical setting when to, because I know 15% increase on KV is doubling the exposure, but I don't know then what's the difference of mass, like doubling your mass. Like when do you know when to use which one? Like is there a right or wrong way to choose?
I
Do you know
don't
what I mean?
think so. And it's just like more like if you're upping the mass, that's more radiation, right? So I think it's better to keep your KV up instead because of that.
Yeah, because
I
the
don't-
mass is like the patient dose.
Yeah, I think it just depends too on situation.
Yeah, because I know like even if you up your KV and it goes through too much, then it's like there, you can't have too much KV.
Hmm.
So I don't know. It's still something out there. Everybody says like, oh, it'll come like with time and you'll figure out how to do it. I'm like, okay.
And I don't know
I
about
know.
you guys, but we all have like set techniques. Like when you put it in, like the portable already has a set technique, or like even like the regular room like brings up a set technique and you can like alter it from there. But it's like, do you do the 15% rule from there, or are those already set to like have a high KV
I think
Like-
you do it from there.
from that
Yeah.
like,
Yeah.
Yeah.
set?
I don't know. I just kind of take my first image and then I'll see the S number and go from
I
there.
guess that's true. You could do
That's
that.
what I do. Because
Yeah.
then it lets me know, like, okay, it's a 300. Like, I want to keep it that way. Like,
Mm.
it's my lateral. I know I'm going to go up a little bit. That's what I've been doing. And I feel like it's easier. Unless the patient is super, like, thin or, like, super thick, then I'm just like, okay, I should probably go up a little bit.
Mhm. That makes sense.
Yeah. It's just
Because-
hard because, like, everyone's different.
Yeah.
Yeah, or if they're like super thin, you can also just reduce the density
Yeah.
Oh yeah.
on that.
Mm-hmm.
The density, is that like a button or something? I don't know. You have like a density button?
I know for my site we do have a
Yeah.
density button.
Yeah, it's like the little person icon, right?
Yeah,
Yeah.
like very
Yeah.
small
Oh,
person
really?
or like bigger
Uh,
person, you know.
I've never
Oh, like
touched
the
that,
large,
but
extra
yeah, it's
large.
there.
Oh,
I-
okay, okay. Then I have
yeah.
one.
No,
I
but
know
I
it's
think
not.
that's
Like what's
only
like -1, +1.
yeah.
or just
Yeah,
this-
+1,
That's
+2.
if you're gonna keep it on AEC. Like if you
Oh,
don't want to do
Oh,
manual
yeah.
technique and you want to keep it on AEC, the machine doesn't know that that's a bariatric patient, so you can just up it. I
What the
think.
heck? I'm gonna have a tech explain
Oh,
to me.
wow. I never even,
Gotta kind of
never
mess
even
with it.
seen it. Interesting. I'm gonna have to check if mine has it now. Does anybody else have anything to add?
Hmm. Well, maybe. Do you guys know what automated data purge is? I know,
I
because
don't know about that.
he used that term for the algorithm. Like what I wrote was using an algorithm for a different body part other than what it was intended for. Intended for is automated data purge. I don't know what I wrote, but I don't
Oh, I think
understand what
that's
that
what
is.
Angela was talking about, how some people would use a foot like
Mhm,
to get the chest x-ray done.
mhm.
A technique to get the chest x-ray done.
Yeah, but what does he mean by the automated data purge? Like, what is that?
I'm trying to see if I wrote that in my notes.
I know,
What
I'm like
chapter
seeing
was
if
that
I
in?
have that in
I
my
gotta pull, let me.
I mean, what I understand by that is that
It's on the slide.
you're altering the information. You know how he said that technically it's illegal to turn in a chest with a foot filter?
Yeah.
It's
But
illegal. We're gonna get arrested.
I know it sounds so bad. Yeah.
I don't even think I wrote that in my notes.
Damn,
I'm trying to look at his slides. Would it be on the slides because it was from his video?
probably on the slides. Yes.
Um,
Yeah, in the algorithm part. I don't know if that's section 10.
Oh, the purge.
Yeah.
Wait. I think it like deletes it after a while, maybe. So
Oh.
he was saying something about like it deleting the original data.
Mhm.
Wasn't that after the 30 days? Or it's in
Yeah,
Oh, I
yeah,
remember that.
automatically.
because the original set is permanently lost, and that's an automated data purge.
Oh, okay,
oh,
that
that
makes
makes
sense.
sense.
Yeah, perfect. Thank you. Yeah, that
Okay.
makes sense.
Thank you. I'm gonna add that in my notes, to be honest.
Yeah, me too.
I didn't even know that. I guess
Ow.
it's put in the name too on purge.
Mhm.
Purge, yeah, to get rid of.
Yeah.
What's
I thought you guys were saying perch, like what birds sit on, and I was like, wait,
Oh,
I don't
I
really
missed
get it
something.
though. So it deletes like the data, obviously after a while, the original data. So then does it show the data as like the foot? Is that what it's saying?
I think so.
Taking away the original.
That would make sense to me.
Yeah.
Because you know how the supervisors were saying, well, Jim was telling us that some hospitals have gotten into troubles for cropping, and the way they find out is that like inspector comes into the facility and they take the mask off. So will that be kind of the same here? And after like certain amount of time, it gets deleted and there's no way to know? Or is that always there?
I think maybe because doesn't it get like archived or something like that? Like after like 10 whatever years. Like you
Yeah.
could bring the image back, but I don't think you could like look into the data.
Yeah,
any-
exactly. Like the editing and stuff. Yeah. So
Yeah.
maybe whenever they come, they just look at the last 30 days.
Yeah.
Maybe. That makes sense.
Or like a year or
Mhm.
So like the original data, like the original S number is deleted. And so basically it's like a fake one because it's like a foot algorithm. So it changes the S number. Is that pretty much it?
Yeah, I think
Yeah.
so. Yeah. So after that happens, you cannot access the original image anymore, right? Like the original chest, and you just have a chest with a foot filter permanently, right?
I think so.
Mm.
Well, yeah. It doesn't like I feel like it doesn't really even show it when you send it to PAX.
No, I don't think so. I think it will only show it if they go back to like the workstation, right? Our station,
Yeah.
maybe.
Okay, guys. It looks like we're running out of time. So I'm gonna go ahead and end this discussion. Thank you.
Thank you.
Okay.